Hi viewers, welcome back. In today's video, we are going to discuss the minor disorders of pregnancy or the minor ailments or minor problems during pregnancy. So, in your exams, you may get as the minor ailments of pregnancy or the minor disorders of pregnancy. So, whenever you come to the minor disorders of pregnancy, you can divide these problems into systems. So, digestive system, musculoskeletal system, likewise you can go on. Okay. So, today we will start discussing about the minor problems during pregnancy of the digestive system. Okay. So, when you come to the digestive system, you have 6 major problems. Okay. So, you can't say that it is a major problem, but it is a problem which is going to exist during pregnancy, but it doesn't matter, or it is not going to complicate the pregnancy. So, whenever you have a minor problem, you have to treat it immediately so that the problem gets resolved. So, in case if you are not treating the minor disorders, it may complicate the pregnancy or it may cause complications for the mother as well as the fetus. Okay. So, we will discuss the digestive disorders during pregnancy. So, first, why does these minor disorders happen during pregnancy? You know, pregnancy is something which is having a lot of changes. Okay. So, you know, there are changes in the hormonal system. So, there are hormonal changes, there are postural changes, there are accommodation changes, like everything is going to change in your body during pregnancy. So, you have to expect for the problems. There must be disorders during pregnancy because the body is undergoing a lot of changes. Okay. So, first, when we come to the digestive changes, we are having a major change in the nausea and vomiting, constipation, acidity or heartburn, Tyalism, Pica and the abdominal discomfort. So, I will teach you in a sequence, that is like why these disorders happen and what is the management. See, I am not going to discuss the medical management. Okay. So, medical management, like once you feel the mother is not comfortable, if the mother is not stable, you have to take the mother for medical management to the hospital. So, that we are not going to talk about the medical management. I am going to just talk about the changes, what is the home remedies or like whatever the home care management we can provide the mother. Okay. So, it is going to be a very simple topic but very interesting topic. Okay. So, nausea and vomiting. So, why does nausea and vomiting happen? So, already we have discussed in one class, we have discussed about hyperemesis gravidarum. Okay. So, that is like an extreme level of vomiting. Okay. So, now we are not going to talk about the extreme level of vomiting, we are just going to talk about the minimal vomiting. So, when you consider pregnancy, nearly 50% of the mothers, they will have nausea and vomiting. So, around 25% of mothers, they report only nausea and 25% they stay like calm, they do not have any complaints. Okay. So, already I have said you will have a lot of changes during the early pregnancy, that is until the placenta is taking up the role of taking care of the fetus, the hormones are going to take up the major role of providing nutrition for the fetus. So, when there is an influence of your HCG hormone and your progesterone, there is going to be a lot of changes. So, when this HCG level is increased, definitely there will be nausea and vomiting for the mother. Okay. So, it is normal. So, it is not going to affect the mother or the baby. Okay. So, when a mother is complaining, okay, so usually all the mothers during the early pregnancy, they say, okay, I have severe vomiting, I always feel nauseated, I feel like vomiting. Okay. So, first statement is you have to tell the mother this is normal. Okay. Tell the mother, assure, reassure the mother. So, when the mother is complaining of nausea and vomiting, tell the mother it is normal and your baby is very fine. Okay. So, explain the mother, tell the mother she is having adequate hormonal secretions, or your HCG levels are in the higher level, so you are feeling nauseated. It means your baby is healthy and your baby is growing healthier. So be happy that you are having adequate hormonal secretions in your body. Your baby is happy with the hormones. Okay, so make the mother understand this is a normal physiological change during pregnancy, so she will be psychologically stable. So that you have to tell. So what does matters which is going to cause nausea? So first we have seen the hormonal changes. Some things like she must have a change in her lifestyle. Okay, so those things, like when she is doing, definitely there will be a decrease in the vomiting or the nausea state. Okay, so first we have to tell about the fluid intake. See, actually mother must take adequate amount of fluid during pregnancy, and during the early pregnancy, you know, there is going to be a hemodilution. So at that time there is a need for fluid intake, and when the vomiting is persisting, she will go in for dehydration and for acidosis. So to correct dehydration, she has to take adequate amount of fluids. Okay, so you have to encourage the mother to take more amount of fluid during vomiting. And then the dietary changes. Okay, see, of course the mother will be happy. She feels like eating many food, like different varieties of food and all those things we can provide the mother, but see to that there is a limit. See, when the mother is eating oily, heavy food, it must be before 7 o'clock. Tell the mother that she must not take heavy, oily, spicy foods in the night and go for sleep. So definitely it is going to cause morning vomiting. Okay, so you have to tell the mother she must take small frequent diets, and that too to avoid all these oily, spicy, all these heavy items she has to avoid. Okay, so that will naturally decrease vomiting. And behavioral changes. Okay, so behavioral changes in the sense you have to tell the mother, usually when the mother is having nausea or vomiting, it is in the early morning. That is like when the mother is getting up from the bed, so she will have empty stomach. At that time what happens, she feels like vomiting. So when she is vomiting in the early morning, it becomes a routine, like she will be vomiting. See, actually the terminology is only morning sickness. So the morning only the mother vomits. So when the mother vomits in the morning, it is going to continue throughout the day. So once you stop that morning episode, most of the time the other episodes also will be controlled. So how to stop this morning episode? So what you have to do is tell the mother, when she is getting up from the bed, she has to sit on the bed. Like she must not just, she can have a goggle, and she has to take dry crackers, rusk, something like which is going to be dry. It is to absorb the HCl secretions that is already inside the mother because of the empty stomach of long period of fasting. So tell the mother like she has to take dry crackers or like rusk, biscuits in the early morning, that is before getting down from the bed, and then she can go in for brushing, she can go in for the other consumptions of beverages and all those things she can take. So the behavioral modifications you have to tell. And as soon as eating, she must not go in for sleep, she must go in for a mild walking. And the night food, like she has to take little more early, that is like oily substances and like whatever she wants to take, that let her take early before 7 o'clock, and after that she must take more fruits. So that will be sufficient when she is sleeping in the night. And in case in the night if she is feeling hungry also, she can go in for fruits. That will be very good for the baby, and it is not going to promote any nausea and vomiting. And then comes the hospitalization. Okay, so when you feel the mother is exhausted, she is vomiting too much, so then you term the condition as hyperemesis gravidarum, and you are going to admit the mother in the hospital. So hospitalization is going to be done when the mother is having hyperemesis gravidarum. So then the physician or your obstetrician, they start with an antiemetic drug, and like they will be starting with IV fluids. In case if you want to learn more about this hyperemesis gravidarum, you can go in for the previous videos, like I have a video for hyperemesis gravidarum, so you can refer that. Okay, so this is with your nausea and vomiting in the early pregnancy. Then coming to constipation. Okay, so again your hormonal changes are playing a major role in constipation. So what does happen during pregnancy? So your hormone of progesterone, it is having a major quality of relaxing the soft tissues. Okay, so what happens, all your soft like tissues, all your muscles, it gets relaxed. So when you are coming to constipation, what happens, like there will be a relaxation of your GI tract. So your abdominal gut will be relaxed, and your bowel movements will be slow. So what happens, the mother will have constipation. So you have to expect there will be constipation, and when she is having vomiting, there may not be bulky amount of food, she may not take lot amount of food. So at that time the bulkiness of the bowel also will be very less, so that may cause constipation for the mother. So when she is having constipation, you have to remember that you have to change the dietary pattern. You have to add more fiber and more fluids in the diet, so that it increases the bowel activity of the mother and constipation comes down. And then always remember active lifestyle. Okay, so that is like pregnancy is something which is very beautiful. They have to enjoy pregnancy, so naturally she enjoys, the baby also enjoys pregnancy. Okay, so it is a happy moment, don't make it as a disease. Okay, tell the mother she has to be active. When she is pregnant, she has to be active. Okay, so she has to go in for walk, she has to enjoy music. Like many people, like they always say, I am pregnant, I am resigning my job. Why to resign? Okay, so you have to be active. You learn, you are a teacher, you are a social member, you see 10 people, you learn lot of things. Naturally your child also learns many things. Okay, so get exposed with people, be active, go in for mild exercises, walking, all these things. Do household works, lot of household works. Okay, your sweeping, cooking, washing, all these things are going to improve your muscular tone, which is going to help you in normal labor. Okay, so you have to do household works. Okay, so all these things keeps you active, and definitely your bowel movements also will be active, and constipation will be relieved. Okay, and then laxatives and mineral oils. Okay, so never ever go for laxatives and mineral oils when there is constipation. It is always with your food, your diet. You have to improve the bowel pattern and never go with laxatives, because what happens, okay, laxatives, they have the functioning of increasing the bowel movements. So when these bowel movements are increased, naturally the uterine movements are also increased, which may cause abortion for the mother. Okay, so always remember, you don't go in for mineral oil intake as well as intake of laxatives, which may complicate the pregnancy. Okay, so that you have to do, and try to add more fluids, fibers. Dietary changes can contribute to relaxation of your constipation. So constipations will be relieved. Okay, and then coming to your acidity and heartburn. So already I said your progesterone is playing a major role. Okay, so that is like, it is going to relax the sphincter muscles. Your esophageal sphincters are there, no, it is going to relax your esophageal sphincter. So what happens, your sphincter muscles are having a special quality, like it is supposed to provide a one-way route. Okay, so it is like only intake you can do, it is not like output. But what happens when the progesterone levels are going to be high, it is like helping the inner content, the regurgitation. So all your acids and the substances which is staying in the stomach, it is going to regurgitate because of the relaxation due to the progesterone hormone. So you have to be like very careful with your positions and like your amount of food. Okay, so you have to have a dietary control. Okay, dietary control in the sense it is always small and frequent meals. Okay, so tell the mother she can have small frequent meals, because like already you have the sphincter muscles relaxed, which can cause regurgitation as well as your growing abdomen. That is like the uterus is going to push your abdomen up, which is going to it is going to cause vomiting or your regurgitation. So what happens? So anything can happen. So you have to go in for dietary changes, and then intake of hot tea or water. Okay, so you can encourage the mother to have a hot lemon tea or a ginger tea, green leafy tea. All these things are going to help you in you, and your ginger plays a major role in control of vomiting during pregnancy. There are a lot of researches which are done, which is showing evidences that ginger is very effective in reducing the nausea and the vomiting sensation during pregnancy. So you can encourage the mother in going for a ginger tea, or like lemon and green tea. Or if nothing is possible, if the mother doesn't like to drink anything else, you can tell the mother to go in for warm water. That will be sufficient. And then change of posture. So always after eating, she is not supposed to bend down, or she is not supposed to sleep during immediately after food. Okay, so that will again cause regurgitation of the food content, which will cause heartburn for the mother. And then fast foods and heavy foods. So totally avoid fast foods and heavy foods. In case if you want to eat, definitely please eat before 6 o'clock. Okay, so that it gets digested, and when the mother is going for sleeping, she won't have that heartburn and regurgitation. Then comes antacids. Antacids are very good. So in case if the mother is having frequent regurgitation and heartburn, these antacids are definitely going to help. So I always say medicines, it is always your secondary level. Home care management is best. So always go in for your home management with your ginger, hot tea, dietary modifications, postural modifications, and all those things. Definitely it will work out. And then coming to Tyalism. Tyalism is nothing but increased secretions of saliva. Okay, so secretions, you know, during pregnancy there is lot of salivary secretion which is going to cause nausea and vomiting for the mother. Okay, so again you have to make the mother remember that pregnancy is not a disease. Okay, it is just a physiological change, and it is going to get resolved within few days. That is like only for the first 3 months she is going to have these complaints, and not above that. Okay, so for the first 3 months definitely she will have this Tyalism will be present, and because of that nausea also will be present. So tell the mother like this is normal, and if she is having excessive secretion of saliva, she can spit, she can carry a spit box, or otherwise like she can carry tissues with her, comfortable. And like she can sometimes use hot candies, so that will control the salivary secretion, so she will be swallowing. And like sometimes you decrease the carbohydrate foods, it will work. And you can even go in for fruits. So fruits are very good sources, like it will control Tyalism. Okay, and then coming to Pica. So Pica is something which is very interesting. Pica is nothing but craving for abnormal things. Okay, so craving, pregnancy, you know, there will be craving for food. It is like abnormal food in the sense some mothers they eat chalk piece, some mothers toothpaste, some mothers salt, differs. Okay, but something is abnormal. Now here again you have to tell the mother it is because of the hormonal influence she is getting these feelings. Okay, so tell the mother once this is crossing the limit, when she is taking a lot of charcoal, when she is taking a lot of coal, chalk piece, toothpaste, what happens? It causes effect on the baby. So make the mother understand that craving can harm the baby. Okay, so she has to restrict the type and the amount of food that is she is craving for. Some people eat lot of rice, so that is not going to cause a lot of major effect on the baby. But in case if she is eating lot of coal and chalk paste, all those things, it is going to harm the child. So explain the mother, she will avoid automatically. Okay. And then coming to the abdominal discomfort. So because of the pregnancy, there is lot of abdominal discomfort. That is like already I said, like your progesterone is going to cause your sphincter muscles relax. Similarly, your bowel bowel movements are going to be restricted because of the relaxation of the intestinal muscle. So what happens? There is lot of flatulence, there is lot of abdominal discomfort, and because of the muscles which are going to hold the heavy weight of the baby, what happens? There is lot of pain in the muscles, the facial muscles around the uterus. It is going to be painful. So at that time there is lot of discomfort for the mothers. Okay. So when you come to the problem of abdominal discomfort, encourage the mother to have adequate amount of fluids and more fibers in the food, like to prevent the abdominal discomfort. So accumulation of flatulence. So in case if she is going in for mild walking, mild exercises, definitely it will reduce the collection of flatulence and the bowel habits will be normal. So however she is feeling like to pass stools or not, she has to have a regular bowel pattern. So early morning she gets up, she goes to the toilet, she has to try whether there is a she is able to pass motion or not. Okay, so regular bowel habits have to be followed. And then coming to the exercises, I said like there must be mild exercises to be present, and she must have a active lifestyle. So again you can try with your hot tea, hot green tea, lemon, ginger, cumin seeds, anything you can try, something which is warm and hot. It is going to encourage relieving of the abdominal discomforts, as well as like it is also going to improve the bowel movements of the mother. Okay, so this is what with your discomforts in the digestive system, that includes your nausea and vomiting, constipation, heartburns or your regurgitations or acidity. And then coming to Tyalism, we have Pica and the abdominal discomforts. So now we have discussed the causes of all these discomforts and the management, the home remedies for the management of these discomforts. Okay, so in next class let us discuss about the other system. Okay, so this is like digestive system we have completed, we will discuss with the other system. Okay, hope you understood the class. In case if you have any doubts, you can go and give your comments in the comment box, and if you want any other new topics also, you can give your comments in the comment box. Take care, bye.